Good morning. This is another episode of Migraine International Patients Perspective. This is episode 18. My name's Stephen Lyford, and I'm a migraine sufferer since the 1970s, and I'm the founder of the Migraine Buddy group on Facebook and a supporter of the Migraine Buddy app. Today, my guest is Jill Ogelsby Dehlin. And Jill is a migraine advocate and a former speaker at the Migraine World Summit. How are you today, Jill?
I'm having a great head pain-free day.
Me too, and I think that's fantastic. And today's topic we're going to discuss is the stigma migraine sufferers carry and how to change that with family, coworkers, and maybe even the general public, if that's even possible. A brief story about me. When I was just 10 years old, I can remember that my mother would have bowls like those old mixing bowls, the stainless steel ones with ice and water in it. And she'd come with cold rags to put on my face and on my neck when I would get migraines so bad, or actually she just said headaches. And they would be so bad that I would be vomiting, and she was trying to calm that with the cold rags. And, without her, I don't know how I would have survived at that age. And then later on in the military, I don't know what they thought of me. They, asking for pain medication because they didn't allow us to keep our own at the time. It was in the late 70s. I guess there was a thing that the military thought that, people were trying to sneak in drugs, so they wouldn't let us keep our own over-the-counter medications. So we had to ask the corpsman for our any kind of pain medication, like Tylenol, Excedrin, whatever. So when I would ask for headache medication, they were like, why are you taking so many, pain medications? So, it was one of those things that created a problem because I asked for so much stuff. And, and then I've had several hospitalizations, for getting to the point where the pain was so bad that you become incoherent, where you can't talk, you can't communicate. I had a situation where all I remember is being able to dial my, this is smartphone age, this is more recent, where I was only able to dial my wife on the smartphone. And what she tells me is she saw my name on the phone, and when she answered, I didn't respond, and she said, Stephen? And I said, uh-huh. She said, do you have a migraine? And I said, uh-huh. Do you need me? Uh-huh. And she said she just remembers leaving work in a panic. And when she got home, she piled me in the car and took me to the emergency room. She probably should have called an ambulance, but I couldn't respond verbally. I was just totally out of it. She just knew she had to get me to the emergency room. But more recently, the CGRP medications are the very first thing in 30, 40 years that's really done anything to help me, that's really made a difference in migraines for me. So, and then recently, you and I had a conversation with a poster on our Migraine Buddy group page that was asking questions about how to deal with family. And I think that's how we got here for this conversation, was they were asking what to do about family. And, family is kind of a, at family, employers, friends that just don't understand what we go through as migraine sufferers, because oh, it's just a headache, but they just don't get it. And what they don't understand, a lot of newer migraine sufferers or those that haven't run into groups like ours, they don't know how to mitigate the stigma that we go through. And that's where our discussion today is going. So let's let people find out, who are you? How did you come to our group? And how did you get involved in migraine advocacy?
Thanks, Stefan. As you mentioned, I'm an advocate for people with headache and migraine. I'm also a registered nurse and a teacher, and those two abilities have really helped me be a better migraine advocate. I had my first migraine in about 1987, when I was about 32 years old. And the only reason I knew what it was is because my sister had chronic migraine. Hers went away when she went through menopause. When I went through menopause, my attacks became chronic. It was as though I went one day, I was having a couple migraines a month. The next month, I was having one every day. And as you know, there are different stages of migraine attacks. There's the prodrome phase, or sometimes people get an aura. About, I don't know, a small percentage of people get an aura. The prodrome phase is where you may feel irritable, and you may have yawning, and you may urinate frequently. You may feel cognitively off balance. So the brain fog. And then you have the attack, which, as you said, sometimes they can be so severe that you can't even speak. And I have also been hospitalized for my disease. And I can remember having the worst migraine attack of my life in the hospital. And the nurse asked me, "What do you do at home when this happens?" And I couldn't tell her. So it's a journey that I wouldn't wish on anybody. The next part of the phases of the disease attack is the postdrome, or when you're feeling like you're bumping into walls. And sometimes you might have just a little bit of head pain, but it's like a recovery phase. So when I was in that really acute phase of my disease, I was in prodrome, attack phase, or postdrome every single day. And as you mentioned, there were not really good drugs for us with migraine. We had drugs that were borrowed from other disease states, like from epilepsy. We used Topamax and Depakote and Zonegran, and those work okay for some people. They did not work okay for me. And they compounded the brain fog that I had. When I became chronic in 2006, I was almost done with my PhD. I had straight A's for all of my coursework up until that point. And then I was working on my dissertation, and it was a really stressful period of time for me. There were other life stressors that were involved, as well as my dissertation research, but I just went from owning the world, having the world by the tail, to being in bed almost every single day. And so I had to drop out of my PhD program, and I vowed to myself that it wasn't going to destroy my life, that it was just going to change the trajectory of my life. So it took me about 4 years of seeing a headache specialist before I had the courage. I'm a nurse. Before I had the courage to stand toe to toe with that headache specialist and say, "I don't think you're listening to me. I don't feel good. We've tried everything under the sun. I've tried over 60 different kinds of medications, and I'm not better. You're either going to hospitalize me, or you are going to refer me someplace else, because I am not happy." So he hospitalized me. And that's when things began to change for me, because I have neck involvement, and I was getting cervical blocks to my neck. I was getting steroid injections over my eye and my temporal mandibular joint and my occiput. Those really helped me. I got well enough so that I could go to the American Headache Society meeting in Scottsdale, where all of the headache specialists go to learn the newest, greatest things. And that really changed things around for me, not only because I found out there was no holy grail for migraine. There were no really great treatments, but there was a new treatment coming on the market. It was a neuromodulation device called the Cephally. And maybe some of you have heard of that. So I started using the Cephally every day. And after about 3 months, I'm like, oh, I only had 5 migraine days this week. And then so gradually that gave me more functionality. But that situation in my doctor's office really hit me. I'm a nurse. I am not afraid of doctors. I am not uncomfortable around medical people. And my feeling was, if I can't even say those words to my doctor without having to rehearse them before I get there and feeling so uncomfortable about it, there must be other people in that situation as well. So I vowed that I was going to help other people not have the same journey that I had. So at this meeting in Scottsdale, I met an advocate who wrote a book on migraine. Her name is Terry Robert. And Terry got me involved in Migraine Advocacy. There was an organization at the time called the American Headache and Migraine Association. And eventually I became the chairperson. And unfortunately, the American Headache Society also had another patient advocacy group called American Migraine Foundation. And they took over a lot of our responsibilities. So we became redundant. We weren't getting the support that I felt that we deserved. So the organization folded. But because of that work, I also was able to be on the board of the Alliance for Headache Disorders Advocacy. And I went to Headache on the Hill because of that position on the AMA board. I was also able to become a member of this new organization called the Coalition for Headache and Migraine Patients, where I met dozens of advocates from around the country. And it really got my foot in the door. So I was able to then educate myself, which I think was the most important piece of it for me, was educating myself about my disease and then helping other people understand the disease. And as you mentioned, there's a lot of stigma around migraine, and that's really what I want to talk about today. There are 3 kinds of stigma. There's institutional stigma, and that's when big organizations, this top tier level of organizations like your job, like the government, are stigmatizing migraine and headache because they don't think it's important or severe. And the next kind of stigma is the interpersonal stigma, where you're talking to your coworkers, your family, your friends, and they're disrespecting you because they think you should be able to pull yourself up by your bootstraps or take a couple Advil and then feel better. And that's not the case. That's not the case with us. So that's interpersonal stigma. But I think the worst kind of stigma is self-stigma. And that's the stigma that comes when we, as people with migraine, start internalizing all of this stigma from all over the place, thinking, you know, they don't think that they don't think it's a big deal. Maybe it's not such a big deal. And so then you don't think that what you have is important or valid. You don't think that you are valid. And so the best way to combat stigma is to educate your friends and family to understand how severe it is. That was hard for me. When I first posted on Facebook that I have migraine, it was hard. I was afraid of that interpersonal stigma that people would come back at me and disrespect me again. But you know what? It didn't happen. And it just was that one small step, talking to my doctor and advocating for myself, and then sharing with my friends and family about how disabling this disease is. And now the reason I wore this Headache on the Hill shirt today is because I am combating stigma at the national level. And in the United States, we have the National Institutes for Health, which fund a lot of research on migraine and hundreds of other disease states. If you take a look at the burden of migraine disease and the amount of funding that we are getting, it's abysmal. Migraine gets about $22 a year from the National Institutes of Health. And another disease that is comparable in the amount of disability it causes gets over 300 million. So it's not equitable funding. And we're trying so hard with the National Institutes of Health to get them to change the laws and to provide more funding for the headache, migraine, cluster headache, all of the headache disorders, of which there are 300. So that's my mission now. And I have purple nails. I have a purple streak in my hair. And the reason I did this is because I'm an older lady and people come up to me and they say, hey, I think your hair is cool. And I say, well, purple's the color for migraine advocacy. And it starts a conversation. So then everyday advocacy, I can educate other people about what's happening with migraine. I got my nails done the other day and there's a hairdresser there who I think has rebound headache. And so I'm educating her as well. So it's little things I do. I'm not a zealot. I'm not on the street corner with a sign. It's just like if people are open, they want to talk about migraine. And that's what I'm doing to eliminate the interpersonal stigma. That's what I've done. But it starts
I have on the back of my seats in my Uber, I drive for Uber, signs for Migraine International Patients Perspective and Migraine Buddy Group, which start conversations.
Yes.
And
advocacy.
Yeah, exactly. And we get into conversations about migraines. And I tell them, I said, if you know somebody that's got migraines or migraine issues, I said, tell them to join our group. And, if there's ever any question that you need answered, I said, I have 1,400 members in 30 countries that somebody there will have the same issue and will have some sort of an answer for you. I said, we're just like a giant family. And I said, and that's what we do there. And I said, we discuss every migraine topic you can think of. And that's how we roll,
The way you and I met was because I interviewed a physician for Migraine World Summit about sex and headache. And that's a topic that people aren't always comfortable with, but I taught sex education for 20 years. So I'm very comfortable discussing those things, but that's how we met. And the Migraine World Summit is a really great way to educate yourself. And a lot of us educate our clinicians because many clinicians don't understand what's happening with migraine. I'm on the boards of the National Headache Foundation. I'm the secretary for that organization. And what we are doing right now to help educate clinicians is called the Physician, oh, criminy, I'm having brain fog. We have 3 programs. One is the primary care migraine program. That's what I'm thinking of. And that is to educate physicians, clinicians about migraine. It's just like a couple of modules. They get continuing education credit, but a lot of doctors only got like 2 hours of study in medical school on migraine. And it's the second most disabling condition on the planet. 20% of their female patients will have migraine, 6% of the men. For pediatrics, it's alarming how many kids have migraine.
I knew that I needed to change neurologists because my neurologist would argue with me. And because he would not, when I told him I wanted off of gabapentin and, and that the Topamax was causing me numbness and brain fog and all that, and he argued with me and didn't want to change my medications, I knew I had to change doctors. And the one that I found She had migraines. And I think that's why she went into neurology rather than general medicine, was she was a migraine sufferer. So I knew I'd found the right neurologist when I found out she was actually a migraine sufferer herself. So that's when I knew I had the right doctor. So one of the things that I try to tell people a lot, is to sit down face to face with their families and tell them, have a frank discussion with them, and tell them that this is a serious disease, and that they're not just regular headaches. And I tell them, bring them to the group, have them read some of these posts that other people are talking about their problems, their pain, their whatever, or go to Spotify and search migraine, and there are multiple podcasts on migraines with different, and some of them are really great. And I've considered doing a podcast for Spotify, but just be dead serious, and and tell them what you're going through. But we have to keep talking about it.
We have to keep talking about it, because now think about the other diseases in the world that have been stigmatized, like epilepsy. People used to think epilepsy was this, horrible thing. If you have a migraine attack at work versus a full-on seizure at work, people aren't going to, these days, they're not going to stigmatize you because you're having a seizure. But if you're having a migraine attack at work, it's a completely different story. If you're having an asthma attack at work or a migraine attack at work,
I have that too.
They're both disabling conditions. And so you shouldn't be embarrassed about it. You shouldn't feel ashamed about it, but educate yourself first and educate your friends and family.
Well, Jill, I appreciate you being here with the Migraine International Patients Perspective. And hopefully we can get you back and we can talk about another migraine subject. My name's Stephan Leifer. This has been Migraine International Patients Perspective.